Hi everyone, I'm Dr. Scott Therrell. I'm the founder and owner of Clinical Thinking Cap courses, and I'm a board certified chiropractic neurologist who's been in practice since 2000. I founded Clinical Thinking Cap courses because I was in desperate need for more applicable ways to teach you as clinicians and integrative healthcare practitioners how to learn about neurotransmitters and hormones and the immune system that are cost effective, time effective, and highly applicable to patient care. I, like you, have sat in a lot of continuing ed classes, and I've been frustrated with a lot of them because a lot of it seems like filler when it's not giving me what do I do to actually help people. And here at Clinical Thinking Cap courses, I wanted to do all of my courses in less than 2 hours time with very specific topics that are highly applicable to integrative medicine. You're going to see a handful of different offerings here. I recommend that you start with Neurotransmitters 101. I think it gives a good basis of something that's been around now testing wise for 2 decades. This all started in 2000 here in the United States. So if you haven't learned about neurotransmitters yet and you have an integrative medicine practice, especially if you have patients complaining about fatigue, difficulty with sleep, difficulty with mood, difficulty with concentration or attention, boy, neurotransmitters is a great place to start. We'll also have classes on stress responses that include the adrenal system and the sympathetic nervous system, and just how stress and chronic stress affects hormones and neurotransmitters and what we can do about it. We also have classes that are on insomnia. And so when we talk about sleep and we talk about insomnia, boy, nothing will change a patient's life faster than if you can help them sleep better, if that's one of their primary complaints. So that's always a well-versed class, and it's been one of my favorites. In fact, 5 years ago, I made a class called Insomnia Insight. It was a 3-hour clinician training video series. We sold it to people all across the country, loving this information. And it's time to just update it and make it a little more focused and a little more appropriate in the neurotransmitter and hormone realm. And so that'll be Insomnia 101. And then we're going to have a whole other one that's just case studies. Now, I don't recommend you start with case studies. If hormone testing and neurotransmitter testing are new to you, don't go there first because you're going to get kind of lost on some of the basic core concepts. But again, as an adult, as a practitioner who has different specialties, I recognize that you may choose different places to start. I still think neurotransmitters is a pretty solid place to start if you're going to follow me down this path of different ways to put your clinical thinking cap on and help with the nervous system, the endocrine system, and the immune system. Now, if you're ready to buy, awesome. Feel free to register, and you'll find out on that registration page when the next class is being offered with whatever topic you choose. But if you're not sure if you like how I teach, and you're not sure exactly what you're going to get, I strongly encourage you to go register for the free complimentary 3-part mini-series on neurotransmitters. Neurotransmitter 101 mini-series has 3 different videos. Each one's about 15 minutes long, and they cover various neurotransmitters and clinical applications. You'll get an idea and a sense of how I teach, how I like to apply things, how I like to describe things to patients in terms of my own office and my own practice. And remember, I've been a practicing private practice chiropractic neurologist since the year 2000. I do this all day, every day when it comes to teaching and describing and explaining these things to my own patients. So just like you, my boots are on the ground all week long, helping people recover and feel better. And I think neurotransmitters and hormones are one of the best ways to do it, which is why I started Clinical Thinking Camp. If you choose to go through the mini-series, you'll get videos over the course of a week, and hopefully you'll give some questions and some comments, and I think you'll enjoy that and get a sense of how I work. And then, if you choose to actually dive into the actual classes, I hope to meet you over there on the inside of those classes. Those mini-series videos are hosted on Rizuku, and the actual classes are hosted on Rizuku, and you'll get a sense of how easy it is to take an online class with a good platform. That platform is wonderfully simple to guide you through what you need to do, how you need to do it, track your progress, and give you motivation along the way. So I think we chose a really great platform for our online learning community. If you have any questions, feel free to email us. If you have any comments or questions, connect with us on social media. Or if you want to, leave a comment and shoot us an email or give us a call, and we'll help you just as much as we can and as fast as we can. I'm Dr. Scott Therrell. I want to thank you for your time, because time is incredibly valuable. I want to thank you for your knowledge and your dedication, helping patients and clients with integrative medicine and holistic health, because I think that is incredibly important. And I think regardless of what type of formal training you have, if you're looking for new tools to put in your toolbox that will help support the nervous system and eventually the endocrine system and immune system because they all play together at the same dance, well, then clinical thinking cap courses are probably something that you'll enjoy very much. Take care.